So, hello again. This is Chris Pickard at Body Imbalance and beatbloodpressure.com. And today I'm joined by Fiona, who's a local GP who I first of all came across mainly because she improved her back pain with diet many years ago, but is branching out into many more things. So, hello, Fiona.
Hello, thank you very much.
Okay. So, first of all, Fiona, I'd love to know more about what inspired you to actually get into medicine and health in the first place? A bit of a general overview.
So, in his wedding speech, my father informed me that I had apparently said when I was 2 years old that either I was going to be queen or a doctor. Given that I did not at that point marry Prince William, obviously I was going to be a doctor. Was at that point in medical school as well, but
Oh, fantastic.
So yes, apparently I've wanted to be a doctor since I was 2. So I don't really know where that came from, although I do know that the GP who looked after us when I was a small child, I still remember her, and I think I found her very inspiring. She was called Dr. Plum, a wonderful name, and I remember exactly what she looked like. She had a bun right at the top of her head. She had some little half moon spectacles on a chain, and she always wore a purple cardigan, or at least that's the way I picture her. I think I found her quite inspiring. Got quite a lot of doctors in the family. My aunt and uncle are both GPs. I always quite looked up to them. My grandmother was a nurse. My other grandmother was actually a teacher but worked in a hospital school. So I think it's always been there. And then the love of science in school and just fascination with how the body worked and all of those sorts of things. And yeah, so I want to go for it.
Okay. And you generally enjoy being a GP?
Love it. I do. Yeah, it's hard work. I only do it part-time because the amount of energy it takes, the amount of giving out all the time. And I think, there are a lot of doctors who still do, a lot of GPs who still do what in any other job would be considered full-time. So they still do 40, 45 hours a week. But that's maybe only over 3 or 4 days. But it's a challenging job emotionally, physically, socially. So part-time, but I love it.
Yes. Yeah, no, I have but two GPs one's an ex-GP as patients, and she became a psychologist instead. And then another one, she's just so stressed. And then a friend of mine down the road, she's a GP, and she just quit her job in the end because she just couldn't. She found it so
and it's really hard. And I mean, at the moment there's a lot of political tension and such like around as well, so that doesn't help. And I think what doctors really want is for the patients to be on their side and see that actually a lot of the time we may be being a bit gaslit, but there we are.
Yes. And then I mentioned briefly that you first probably came across lifestyle medicine with your own cure for back pain, going
really,
which you've spoken about, and so people can find the YouTube video I did about that. And I'll put a link below the description if you want to know more about back pain and diet. But you're also trying to now help not just with diet and nutrition, but you're trying to sort of branch out a little bit more with general wellness and well-being, and trying to encourage your patients in other ways and do some stuff outside of being a GP as well. So can you tell me sort of what's happened, what made you decide to do other things, do more?
Yeah, so I think I've had a growing interest really in nutrition and lifestyle and general well-being, and how our body, mind and spirit are all connected. I've seen, obviously, with my dietary change for my back pain, quite how much difference diet can make, and that then prompted me to start doing a bit of when I say research, I don't mean my own original research, but as in looking at what's out there of knowledge about diet and what we do know and what we maybe still don't know, and came across lifestyle medicine and people who are doing lifestyle medicine. And these pillars of lifestyle medicine. So it includes a lot of diet and nutrition, but also sleep and mindfulness and exercise and having social connections. And I think through COVID, we saw, how detrimental lockdowns were to people's health, but more so than a lot of, I think quite a lot of doctors had thought it might be the case, but certainly, general public and the government just didn't seem to really realise that maybe not hugging people could have really quite significant detrimental effects.
Yes.
And what we saw was that it's affected people's immune systems, it's affected their mental health, it's affected their resilience, it's affected, maybe it's partly the sitting down more and they're not going outside so much, but, vitamin D levels, but also muscle mass and so many things. And actually how everything connects, and how if your mind is working well, and your body is working well, and you feel spiritually more connected to people and socially more connected to people, and how everything just comes together. Yes. And looking at the etymology even of the word disease, or, dis-ease, so we're not at ease with ourselves, and just starting to think more broadly and wanting to explore that more. So I've done a lot of, we call it CPD, continuing professional development, over the last 10 years, really, looking at different lifestyle things and more nutrition type things, dietary interventions, and becoming more and more aware that every drug that we give not only has the side effects that are stated, but actually interactions, and every drug has negatives, and you give the patient one thing and then they need something else because of the first agent, and then they need something else because of the second agent. And we have this huge burden of chronic disease on both society, but also the individual. Mm-hmm. And I wanted to find ways that we might be able to break that cycle, to empower people to actually live more sustainably for themselves, for the planet, for the society, in a way that's actually going to help them feel well, not just managing a disease. So I started looking into that, and I decided to set up a small business to try and see people, to give advice and information and education to try and help with that process, really.
I like that. I got a little sound bite from you there. To break the cycle, to empower people and live more in a more sustainable way. So yeah, fantastic. Not just good for themselves, but for the planet as a whole. Yes. When you actually start thinking.
Absolutely. And I think you have to think broadly, really.
More well-centrically, and the fact that yes, every chronic disease, it's not just about giving a drug to fix an individual symptom. It's about, we are an integrated being.
Absolutely. And I think
it influences our blood sugar levels.
Exactly. And that's not known by probably most doctors, let alone most of the public. And I think as well, I've become skeptical, possibly even cynical, about drug companies. We know that, in our logical brains, we know that a company, a business, is there to make money for its employees and its shareholders. We know that, but we don't think about that. We think, they've made this lovely drug to help people. Well, no, they haven't. They've made this lovely drug to sell, to make money for their employees and their shareholders. And it's not. But what I suddenly realized was, no, it doesn't actually make good business sense for a drug company to make a drug that cures somebody.
Right, yes.
It's only really good business sense for them to make a drug that the patient needs to keep taking to manage their symptoms. That's good business sense. So I started thinking about that sort of element as well, and was like, what are we actually doing here, and why are we doing it, and have we got things right or wrong? So
yeah, indeed. And so you mentioned the set up a small business, and we'll get back to that in a moment, but are you able to bring some of these 6 pillars of wellness into your daily practice as well, to help influence your patients?
Absolutely. So I've undertaken a couple of courses, and one of the particularly good ones called Inspired Medics, and it was it's set up via GP who wanted to help people, who help doctors and other healthcare professionals in primary care to practice evidence-based lifestyle interventions to help patients. And it's really set up to be able to kind of give sound bites and little bits of information to patients at different times. So yeah, I mean, I would say I use knowledge that I've gained from that and other reading in probably 90% of my consultations. It's massively changed how I consult. It's massively changed how many drugs I prescribe. And actually within my practice, some of my colleagues kind of say to a patient, oh, I think you should maybe see this doctor to maybe think things through a bit differently if you're willing to make changes yourself. So it's really nice to have the support of my practice as well.
Yeah.
So yeah.
So you're actually getting referrals from other GPs.
Yeah, within the practice, obviously.
Within the practice, because they're realizing, hang on, there's something else that can be done here. This person doesn't need to take this drug. They can actually change their lifestyle, which caused the problem in the first place.
Exactly. Yeah. And you know, they're starting to the other doctors, I make sure I write really good notes so that actually if they're seeing the patient, they can learn from the notes that I've written as well. So just to try and educate us at the same time. But you know, then some of them will ask me stuff. It's always two-way. I mean, we've all got our own specialties. You know, one of my colleagues knows a huge amount more about menopause and HRT than I do. Brilliant, because we can chat, and you know, other colleagues have other specialties, and we chat things through, and you're constantly learning. It's one of the really good things about general practice, I think.
Fantastic. So are there any I know you can't, you know, I'm not asking you to share names or anything, but is there any particular patients that, when you think about lifestyle changes, or any particular patients that you think, yes, I've helped them like this, or anything that really stands out? Any example?
So there's a patient that I was just talking to earlier, who is she came to me, she was very, very concerned about her weight, but also general, you know, lethargy and lack of motivation and just feeling rough, and just not knowing where to go with it, and already on a whole cocktail of medications, including, you know, significant pain relief medications, and you know, struggling with the side effects from those, and needing, as we talked about, needing to take another tablet because of that tablet. And I've worked with her now. I think we've had maybe probably 6 consultations over the first few were quite close together, but then so 6 consultations over maybe 6 months.
Right.
It took her about 3 months to kind of decide that she was going to be able to make any change, because as I say, one of the things she was struggling with was motivation to even, you know, get dressed in the morning. I talked to her today, and she's very deliberately not stood on the scales.
Right.
You know, very sensible, but she's aware that her dress size has changed. She's aware that her face shape has changed. She's aware that her hair looks better. She was telling me how much she'd managed to do in the morning, and how she'd already cut down some of her pain meds without even talking to me, and wanted to consider cutting down some of the other medications she was on. You know, we're talking here things like antidepressants and gastric medications to stop reflux and all sorts of things, really. And that was just really, really encouraging. So that's a current case. And then there's another patient that really comes to mind from a few years ago who had very, very poor diabetic control. And they were relatively, I mean, not super young, but relatively young for having type 2 diabetes. And this was when I was sort of first starting to try and include what I'd learned from doing my own dietary changes in chatting to my patients. So I felt I had to be really careful, because it was pre even the BMJ talking about low carbohydrate diets or anything. So we were talking sort of 2014, about 10 years ago. But I said, look, you know, this is outside of NHS guidelines, but this is what I'm wondering if it's worth you trying. How do you feel? And they said yes. They said they'd like to give it a go. So I gave them the Primal Blueprint, which is the book that I read that kind of started me on my back pain and diet journey, really, to read. They just borrowed my copy, and they came back and they said, I've made all these changes. Can we recheck my blood sugar in 6 months?
Yeah.
And their levels had dropped from 108 to 50.
Right.
So I mean, 50 is still just within the diabetic range.
Mm-hmm.
But it's not far off. We gave it another year and they dropped down to 36.
Okay, excellent.
At which point we took them off their diabetic medications, and they felt significantly better. And then they came off most of the other medications that they'd needed because of the diabetic medications causing gastric problems and such like. So that was a real early phenomenal success that I think probably helped spur me on to keep looking into it and keep trying and learning. So
yes. Yeah, I think an important thing there to realize is with the lady you've spoken about, 6 months and no motivation. It's a gradual process.
Absolutely,
it's a gradual process. And this is where a lot of people they feel like they're not getting there because drugs can work phenomenally quickly. I mean, some of them are like overnight, within moments. And so they think, well, if a diet doesn't change something within a few days or a few weeks, it's not going to work. But the fact of the matter, for something like diabetes to actually come about in the body, it's got to be there for years. You've got to have dysfunction happening over many, many years.
Yeah.
And at the end of the day, a year and a half of eating better for the guy who's diabetic to get down to off of his med, a year and a half of diet to get off his med versus an entire lifetime of staying on drugs. So that's one and a half years versus like 60 years of medication and poor health.
Absolutely. And I mean, I can only say what happened for the next 3 years after that, because I moved surgeries after that point. But he was still doing really well at that point. So
Fantastic. So are there any particular myths about sort of diet, nutrition, and lifestyle that you'd like to dispel?
Goodness me. There's so many.
Yeah, okay. Well pick some think of some of the biggest things that people might be skeptical about trying, like whether they're doctors or whether they're patients.
So I think the biggest myth still out there is that low carbohydrate diets which are relatively high in fat are bad for you.
Right.
So I think the low fat myth is still very prevalent. And that is one of the hardest things to get over. And it wasn't really until I read was the BMJ. It might have been the New England Journal of Medicine, but I think it was the BMJ. Had something about fats, but it was pretty much a whole issue with various articles and such like. And it became very clear from reading the editorial and then reading some of the research that at no point when research was being done into kind of fats and them being bad for you, at no point had anybody ever divided out different types of animal fats and different types of vegetable fats. So they divided animal and vegetable derived, but not the different types. So, for example, goose fat and beef dripping are relatively easy to digest, where pork fat, much less so. And particularly because most of our pork in this country is consumed in an ultra-processed food form, so ham, salami, bacon, sausage. Actually, even there, is it actually the pork that's the problem, or is it the fact that it's combined with all these sort of what Chris Van Tulleken in ultra-processed people would call non-food substances? And the vegetable oils, they've never divided out your sunflower oil from your coconut oil, and those are two incredibly different. One is hugely processed for a start, and liquid at room temperature in the UK, and the other is really not very processed and solid at room temperature in the UK. And those are two very, very different fats. And actually, I realized that the nuances were lost. And I think this is quite commonly true in public health messaging, unfortunately. But it means that sometimes you end up stating something that's actually untrue. So animal fats are not bad for us. There are some people who do have to be a little bit careful with some of them, but they are not generally bad for us. Vegetable fats are not generally good for us. And sunflower oil, I think, has done quite a lot of damage, in my personal opinion, in terms of long-term chronic health issues, particularly ones that are inflammatory based.
Yes.
So that's probably the biggest one. For me.
The whole the fats, yes, exactly. And it's also true as well, because in the world where we've been going on about you must eat more good fats and ditch the carbohydrates, now it's coming to realize, well, actually there's some really funky stuff in carbohydrates. That's all. And so it's all come back to we need balance again.
A bit of balance is good.
We need balance, but yeah, absolutely. I think that's a really good point, that there are different kinds of fats, and pork fat is different from beef fat. And yes, maybe it's actually the way it's processed that's the problem.
And I think as well, we need to remember that actually we need to individualize things. And that's very hard. And that is something that takes training and takes partnership with a patient, to sit and learn with them what can they tolerate, what can't they, what do they digest well, what do they not. You don't need fancy tests for that. There are lots of doctors and people, nutritional therapists and such like who do use fancy tests, but actually you can do it on history and on really thinking on taking notice of your body, which is what I aim to do, really.
Yes, I don't actually do fancy tests. I used to do fancy tests, but there's actually a lot more in the blood test that you do than most people, including GPs, realise.
Yes, I learned some from you already.
We spoke briefly about that. And I'm forever seeing patients. I've been to my GP and I feel bleh, as you put it, and the blood test came back normal. And it's because all those normal ranges are based on people who feel bleh, going to a GP.
Absolutely.
They take the blood test of someone who it goes to a lab. The lab sees these ranges and says, well, the middle range is where we want to be and what's normal. But that's just the normal middle range for people who feel
Absolutely. And I think as well, in the NHS, we do quite crude, some of them are quite crude blood tests. So for the instance, B12, we do plasma B12. And actually what matters in terms of how a patient feels is actually their intracellular B12 and their brain B12. So which is
very different test. So some tests don't mean anything, like B12 by itself doesn't really mean anything. But you've got to look at other things in the blood test to actually look at the symptoms, ask the patient questions, analyze.
Absolutely, and they are helpful. Even a plasma B12 can be very helpful, just to kind of give you a bit of a ballpark that you can start from.
Yeah, gives you something. Yeah. Okay, so you've spoken a little bit about all those things that I wanted to ask about. So tell me more about, in the closing minutes, how do you want to help people? You said you've got your GP practice and that's going really nice and you want to keep with that. But what ideally would you really love to do for your patients and clients that is something that you can't currently do as a GP because you don't have the time?
Yeah, so sort of in this little side business, I want to, it's a combination really of educating and advising and working alongside, and obviously we work alongside patients in general practice, but really kind of taking that an extra step. So I do one-to-one sessions with people, and can sort of really sit with them and work through all the lifestyle things, not just the nutrition stuff, but all the lifestyle things. And that takes time, an hour and a half for a first appointment usually, and then follow-up appointments of sort of 45 minutes to an hour depending. But I also have developed a course which I would love to run. I've run a pilot, it went really well. But that is much more, so that's for people who feel that maybe they don't need something too individualized, but they just don't know where to start, and they maybe know very little and are aware they know very little. So I talk about, you know, a session on carbohydrates, a session on proteins, a session on fats, a session on vitamins and minerals, and then really about what foods, or, you know, real foods, and then a bit about ultra processed foods. And then in the group setting, sort of get people to think about how their diet is at the moment, what sort of diets they might consider looking at, you know, paleo, primal, keto, vegan, vegetarian, you know, all these sorts of things. What's good about them, what's bad about them, what might work for them and their families. And start kind of thinking things through in a group setting, small groups, sort of 10 ideally would be perfect, okay. 8 to 12. So that's another thing. And then I'm passionate not just about the whole nutrition side of things, but the cooking side of things.
Yes.
And I'm really aware that I see so many patients in my practice, in general practice, who just sort of say, but where do I start? I say, you know, maybe you could think about changing from eating breakfast cereal and toast. And they go, but what do I eat for breakfast? Won't everything take a really long time to cook? Or what do I eat for lunch if I don't have a sandwich? I just don't know where to start. And how do I convert my pasta to something that's still tasty and that doesn't take me hours in the kitchen? And so I'm passionate about cooking, and cooking for a family. I have a challenging family cooking wise.
Yes.
I try to eat paleo. My husband's vegetarian. My daughter tries to be vegetarian some of the time and is also autistic, and my son struggles with a lot of textures.
Yes, that was very interesting. Yes.
And so one of the things that I offer is to actually go into people's houses and sit with them and look through their fridge and look through their cupboards and look at what they've got in terms of equipment for cooking and space for cooking and what their budget is, and work with them to create a meal plan that will work for them and their family, that will be healthy, that will help them with whatever their goals are, and that will be appropriate for their situation. So that's something else that I offer as well.
Yeah, that's fun. Yeah, having a mother of challenging children, and then that whole texture thing, because I know that's a big issue for so many people.
Yeah, it is. Yeah,
things, and actually coming up with remedies for that would be fantastic. So maybe we should actually do an entire separate interview about just food and cooking and textures and stuff and things.
Very happy to do it at some point.
Yeah, that could be very interesting. So just very briefly, the course that you were talking about, is that something is that an in-person thing, or is that going to be like on Zoom as a group thing?
So that I have developed that as an in-person thing, mainly because I think that bouncing those ideas around in a room and having that really immediate kind of question and answer and such like, I think it works better in person. I think if I had loads of people who were wanting to do it, who were far away, I'd be very willing to look at how I adapt it for Zoom. But at the moment I've developed it as an in-person thing, but we'll see how it progresses.
For local. Okay. Oh, that's fantastic. Well, thank you so much. I'm sure we're going to speak again. Okay.
Yeah, that would be great.
And so your current website was it hope-for-health?
Yes. .com. Yeah.
So I will actually put that as a link as well.
Oh, thank you so much.
In here as well. And thank you once again, Fiona, and I wish you a lot of luck with everything very much that you're doing, and carry on educating people. And I shall speak to you soon. So that's bye for now. And
excellent. Thank you so much. Bye bye.